So how can we tell a person is having insulin resistance? There are certain symptoms which is telling us the person is insulin resistant. First of all, you can see the excessive body fat around the tummy, that is abdomen. So that is also known as the visceral fat around the abdomen. So that also can lead to insulin resistance. Second is either you have some genetic history of diabetics too in your family. Third is your diet, where you will be taking a high refined carbohydrate sources which instead of taking whole grain sources. Fourth is you will be having lack of exercise or physical activity which will lead to insulin resistance. Next, what is the symptoms of insulin resistance? So once you are having insulin resistance, the body will start showing the reactions. How it will show? Like Acanthosis nigricans, where you will be having velvet-like patch over the back of the neck and over the armpit and gorion areas. So this all are showing or symptoms for your insulin resistance. Next, you will be having a small resistant tags over the neck, or this is like a small benign granulation tissues which is showing your body is insulin resistant. You can see over the corner of the eyes, over the neck, all these areas is showing that it is having the insulin resistance. So next is like you won't be able to reduce your weight even if you do exercise also, or else if you skip the meals also, it will lead to bloating instead of delayed weight loss. There will be a delayed weight loss even you are doing some initiative to do that. So how to diagnose this? Okay, all this will be done with a proper routine blood sugar testing, like fasting blood sugar level, postprandial blood sugar level and HB1AC. This will give you a clear picture whether you are pre-diabetic or you are at moderate risk or you are at high risk. Next, let me talk how can we control. Okay, let me see how can we control this, or like how can we reduce the symptom and the causes of insulin resistance. First of all, try to build your muscles instead of going for a weight loss or just like a random diet. Go for a building muscles, a proper gym you can join. You should sweat so that your body fat will be burnt out. Okay, next is follow a diet. Okay, step number 2 is to follow a diet which is having less carbohydrate. Okay, you should not go for refined carbohydrates. You should have lean protein, high fiber and proper vegetables and fruits. So you will be able to reduce your weight through a proper diet. After that, you should have like a window period, a proper eating window period. This is also known as the period where you will be eating for suppose you are eating for 12 hours, the next until night. Okay, you should start eating your food in the proper time and you should end it before 6 p.m. and you should give a period for this fasting, that is 15 to 16 hours. So also known as intermittent fasting. So it will help you to burn out your fat and reduce the spiking up of glucose in your blood. Okay, next we have to go for post lunch movement. So this will help your body to reduce the glucose spikes, and this will be converted into some form of energy and prevent you from insulin resistance. And the last, not the least, your sleep. You should have proper quality time for sleep, and at least you should sleep for 7 to 9 hours. You should have some mindfulness, or you should do some sort of relaxation or stress-free things. These are the some techniques we can follow. But you are having severe insulin resistance, kindly reach out to your endocrinologist nearby and try to roll out this course. Okay, with proper medication and diet, all that things. So it will be helping you. So I hope this video will be useful for you. Wait for my next videos. Until then, bye from Dr. Mariea.